like to thank everyone for joining, and we hope that people learn a lot from what we are about to present here with a few doctors and representatives. Why don't I turn it over right now to Dr. Dennis Deer for the introductions of the elected officials that we see here and opening remarks, and then we'll move forward with our agenda. Dr. Dennis Deer.
Thank you so much, Representative Ford. Good Saturday morning to each and every one of you all. We are very thankful that you are here today. We believe that, as the old proverb goes, education is never neutral. It is either liberating or oppressing, which means education will either set you free or put you into bondage. We call what we're doing here, the Westside Black elected officials and other partners, liberation education. It is education that will set you free. We have assembled a fantastic panelist, which you'll meet very shortly, who will talk about the various aspects of coronavirus as well as vaccination and what that means. There will be an opportunity for Q&A. And again, this is all about education. This is about helping to educate the community, all of our constituency, but also to get rid of the myths that are out there. So we're very, very thankful to be here. Thank you for signing in, and it's very, very much appreciated. We know that some of our officials will be joining us a little bit later, but I want to take an opportunity to acknowledge those who are here with us today. Obviously, I'll start with my good friend, Representative La Shawn Ford, who was one of the individuals who kicked this event off. It was his initial idea. We all jumped on his coattail to make this event a success. So thank you, Representative Ford, for your vision, for your foresight. Another good friend is President Carrie Steele of the Metropolitan Water Reclamation District. She just waved her hand. Thanks for all you do, Madam President Steele. We then have another good friend, Lindsay LaPointe, State Representative. Thanks for all you do. That's my fellow social work psychologist person on the at the House of Representatives. So we're thankful for you. Then I got all my friends here. Another good friend, my soror and friend, Camille Lilly, State Representative Camille Lilly. We are thankful for the great work that you're doing in Springfield. We appreciate you so much. A shout out to Deltas. You know, I got to put that out there. We appreciate you, sister. Then another good friend of mine is Metropolitan Water Reclamation District Commissioner Kim DeBouclay. Shout out to the AKs then. Thank you, sister. We appreciate you for all you do. Hey, and I know that Carrie's a Delta, so I'm gonna shout that out as well. So we are very, very thankful. I think I see Senator Maddie Hunter, who is also a great friend and capacity building and leading down in Springfield. Thank you for being here with us. And we have also another friend, Debbie Myers-Martin. We are thankful for the wonderful work that you are doing in Springfield as well. Thanks for being here with us on today. And so we are thankful. I think I got everyone that's on our list on today.
We have two. We have State Rep Lindsay LaPointe.
We got her.
We got her?
Yeah, we got her.
Okay, good.
I've known Lindsay for a minute. We pushed that out.
All right, thank you.
I think we got everybody. I think we got them all.
Hey, so we're about ready to go then, Dr. Dennis Deer.
Indeed, indeed, indeed. So thank you, each and every one of you elected officials who are here with us today. We know that some others will be joining us a little bit later, but thanks to the ones that are here and making things happen. So without further ado, we want to ensure that we introduce you to our speakers on today. These are the individuals who are doing great work, who are out there at the front lines and putting in work for the benefit of all of us. I want to start out with Dr. Karan Joshi, who currently serves as a senior medical officer and co-lead at the Cook County Department of Public Health, where he oversees the department's behavioral health, chronic disease, communications, and community engagement, lead poisoning prevention, and epidemiology units. He is also the attending physician with the Department of Family Medicine at Stroger Hospital. Dr. Josie has been a critical component of what we are doing around coronavirus, around COVID vaccinations, around a whole distribution plan. He has just been fantastic. He has a partner in good medicine that he works along with, who is his co-lead, which is Dr. Rubin. Both of them have been leading. I work very close as chair of health and hospitals with them at Cook County. They have done a fantastic job of leading our charge. So I won't go through the entire bio, but Dr. Josie, thank you so much for all that you have done and continue to do. Our next person is from, yeah, we can clap for him. Woo. Next person is Miss Tamara Mahal. And Miss Tamara Mahal, we're thankful that she is here with us today. She comes from the city of Chicago. She's dedicated to finding innovative solutions for today's emergency preparedness challenges. A self-professed disaster geek. Now, you guys, that's something to be a disaster geek. Tamara has 15 years of experience in roles that include coordinating community disaster programs for the American Red Cross, and responding to wildfires, tornadoes, floods, ice storms, hurricanes across the United States, and developing the emergency management program for Amherst College. In her role as Assistant Commissioner, Resilience for the Chicago Department of Aviation, Tamara combined her passion for emergency preparedness with her commitment to keep those that work and travel through the nation's busiest airport, which are the international airports, safe. Today, she's leading Chicago's COVID-19 vaccine operations, the most efficient and most equitable vaccine distribution system in the United States. Tamara, we are thankful that you are here with us today. Thanks for all that you have done and will continue to do as it relates to helping us through this pandemic. You are appreciated. Big hand clap. And I'm going to turn it over to my good friend, Representative La Shawn Ford, who will introduce the wonderful Dr. Kimberly Baylor.
Thank you very much, Dr. Commissioner Dennis Deere, for those introductions. And I have the great honor to introduce Dr. Kimberly Baylor. She is really the one that reached out to all of us to say that we need to get the message out, get the word out about vaccines and about this COVID-19 pandemic. She's been on the case since the beginning. We've had webinars and we've had town hall meetings with Dr. Baylor since the beginning of the pandemic. And so I want to thank you, Dr. Baylor, for being on top of this. And you are definitely a person that gets things done, and your bio will explain it as I read it now. Dr. Kimberly Baylor is a dynamic and accomplished physician with extensive experience in the medical field. She is an assistant professor of clinical medicine at Northwestern University Medical School. She is a board certified in internal medicine and has been elected to the fellowship in the American College of Physicians. Throughout her tenure at Northwestern Memorial Hospital, she has been recognized for her contributions and remains in good standing as a faculty and staff member. She is a proud graduate of Meharry Medical School here. She is a proud graduate of Meharry Medical College, where she obtained her MD degree. Dr. Bell has been honored to contribute her knowledge and experience through various media opportunities, including Ebony Magazine, Northwest Indiana Times, the Chicago Tribune, and the Daily South Town. Furthermore, she has been invited on multiple local news stations as a featured guest, including ABC, NBC, Fox News. And in the March 2006 issue of the Chicago Hospital News Healthcare newspaper, Dr. Bell was recognized as one of Chicago's top physicians. Among Dr. Bell's most cherished accomplishment is a lecture series she began in 2005 entitled Healthcare for the Homeless. That took place at the First United Methodist Church at the Chicago Temple. On every Tuesday of each month, she presented on a various of health topics to approximately 50 homeless men and women from 2005 to 2008. In 2010, she was named one of the top 25 influential Black women in Chicago by Rollout.com. And in 2011, she was named one of Illinois' most powerful, influential women by the National Women's Conference. The Chicago Defender paper honored her with the Woman of Excellence Award in 2013. Since the beginning of COVID-19, she frequently volunteered with Northwestern's COVID-19 Hotline. Moreover, she has served as featured speaker on COVID education, awareness, and vaccination for numerous organizations, including Alpha Kappa Alpha Sorority, Inc., Northwestern University, and the Democratic Women of the Southland region. She has also partnered with me in the COVID-19 efforts in educating the South and West Side audience on COVID-19 and its impact on vulnerable populations. And for a more personal note, she currently resides in the western suburbs of Chicago with her husband, Mr. Sam Valar, and their 3 children, Kristen Nicole, and twins Alexandra, Olivia, and Sam. Now you see, we are in good hands with our panelists. So thank you very much, Dr. Bell, Valar, for all that you've done, and the ball is in your court.
Thank you, Representative Ford. I appreciate that great introduction. Thank you so much. And once again, as usual, it is a pleasure collaborating with you as we educate our communities. So, ladies and gentlemen, I'd like to start today with a brief overview of COVID-19. What is COVID-19? So COVID-19 is the disease that we know is caused by a virus known as SARS-CoV-2, which stands for Severe Acute Respiratory Syndrome Coronavirus. And it is also has been referred to as a novel coronavirus, that it is novel or new in that we have never seen this before. There are actually 7 different coronaviruses, 4 of which are benign or harmless. As a matter of fact, likely everyone listening today has had a coronavirus infection, because coronaviruses cause about 30% of the common cold. However, 3 of these 7 are deadly strains. And 2 of those are SARS-CoV, which you may recall from the early 2000s, and currently SARS-CoV-2, which is the virus, as I stated previously, responsible for the disease COVID-19. So you may ask, where did this come from? So it is believed that it originated in China, in the province of Wuhan, and we believe it may have come from a bat and was then transmitted to an animal vector, and from there on to humans. And then from there, as we know, human to human transmission. When we speak of transmission, we do know, and it has been proven, that wearing masks or face coverings will help to reduce the transmission of this virus significantly. So I'm going to go through this schematic here briefly. So we see the individual on the right who is wearing the mask, who is healthy, speaking with the individual on the left who is not wearing a mask, who actually has COVID-19. Your probability of transmission, even though you're wearing a mask, is extremely high. However, if we switch that around and the individual with the mask with COVID-19 is wearing the mask and the healthy individual is not, the transmission is actually much less. And then very obviously, if you both are wearing your mask and maintaining your social distancing, the probability of transmission is closer to zero. So it just stands to prove that wearing the mask does protect us. As a physician, I see patients every day, all day. I wear my mask, my patients wear their mask, and I can attest to the fact that I have not contracted COVID-19 at any point. Masks do work. Next, I want to speak a bit about COVID-19 testing, because as we know, COVID-19 is spread by respiratory droplets. So if you cough, sneeze, or even talking, laughing, we know that droplets will escape from our mouths or our noses, and that easily is how it is spread. And so we have tests that individuals can attain in order to determine if they have been infected with the virus, because we know that the symptoms can vary. They can be anywhere from being entirely asymptomatic, but you may be curious if you've contracted the disease because maybe you learned at one point you were around someone who actually had COVID-19. Or you can have symptoms that could range from something as simple as a sore throat, a cough, a fever, low-grade fever, diarrhea. Many complain of loss of taste or smell. So these are various symptoms that you could have that could potentially clue you in as to the possibility of having contracted the disease. So testing is very important. And so of the tests that are available, the three most common are the nasal swab, the nasopharyngeal swab, and the saliva test. The saliva test we don't see as often because it's not really considered to be as accurate. However, if the nasal or nasopharyngeal were not available, the saliva test would be fine to do. The nasal swab is when the Q-tip is inserted into the nostril, but it doesn't go as far back as the nasopharyngeal, which goes to the very back of the nose and to the upper portion of the throat. And we do believe that this is the most accurate in that the virus itself tends to reside in those deeper recesses. Then we have the antibody test, which is not a test that lets you know if you have the infection. It basically is a blood test that can be done at your physician's office that lets you know if you've had prior infection. However, say if you were to come into your doctor's office and say, Dr. Dear, I believe I may have had COVID-19 back in April when tests were not as widespread and I was never tested. Can I get the antibody test now to see if I had COVID-19 back in April? Well, the answer would be no, and that is the antibodies that are produced when you get the actual infection only last in our bloodstream for so long. Therefore, there's a high likelihood that if you were to be tested months after your suspected infection, that the test would be negative. However, if you entered your physician's office and it was maybe a month or two after infection, and you believe that you indeed had COVID-19, then it would be positive, likely. And then the next question that I frequently get is, well, if I have had COVID-19, then is there any need for a vaccination? Like I should be good. I should have the antibodies. I should be okay. Correct, Dr. Bell? And what I respond to my patients and say is that right now we don't really know the answer to that, but it appears that those antibodies that one may produce after having had the infection may only be good for about 90 days. Therefore, if you have had COVID-19, it is still strongly advised that you get vaccinated as well. So now let's shift gears a bit and speak about COVID-19 and Black America. As we all know, COVID-19 has had a devastating impact on African Americans, and many of you may be familiar with this graphic I'm about to share. So back around April, May, when COVID-19 was hot and really on the scene, and we were all just learning more about it and seeing just the huge impact on our communities, we can see here, so let's take the state of Louisiana. African Americans make up about 52% of the population of the state of Louisiana. However, African Americans were making up 70% of the COVID-19 deaths. Let's take our great state of Illinois. African Americans make up about 15% of the population. However, almost 50% of the COVID-19 deaths. And more specifically, let's look at the city of Chicago. We make up about 30% of the population and about 70% of the deaths from COVID-19. I have another slide that I would like to share with you as we look at numbers of cases. So the blue bar represents white Americans, the orange bar, African American, the green bar, our Latinx population, and the yellow bar, our Asian populations. Because you can see here, as far as numbers of cases, when you look at the white Americans versus African American versus Latino, you can look at the numbers and see where we have just been hugely disproportionately impacted. Next to that, you see the hospitalizations, the same story, and also for deaths. So the question is, why is this? We do know that it's largely, almost, if not entirely related to something known as the social determinants of health. Social determinants of health are the conditions in the environments in which our people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. So when we look at Blacks relative to whites, we are more likely to live in neighborhoods with a lack of healthy food options, green spaces, recreational facilities, lighting, and safety. We are more likely to live in densely populated areas, which increase our potential for contact with others. Blacks represent about 25% of all public transit users, and we're also less likely to have equitable healthcare access. We're more likely to be a part of the essential workforce, where we represent nearly 30% of bus drivers and nearly 20% of all food service workers, janitors, cashiers, and stockers. So for obvious reasons, we have been severely impacted, deadly impacted by this COVID-19 virus. So COVID-19 vaccine, let's shift gears once again. Mistrust within the African American community. So we know that vaccine reluctance is at a fairly high rate within our communities. One study shows that only 14% of Black Americans and 34% of Latinx Americans have trust in the safety of a new COVID-19 vaccine. So what are some of the reasons for this reluctance? What are some of the very good reasons for this reluctance? So what we often refer to as the Tuskegee syphilis study, which, as you know, ran from about 1932 to 1972. So it ran for 40 years. And the goal of this study was to track the natural progression of syphilis in Black men. So these men had the treatment for syphilis withheld from them. And the last surviving member of this cohort died in 2004. So this wasn't so long ago. So this is on the minds of Black America. And this also is what is feeding into this mistrust within the African American community. When you look at a people that has suffered from just extensive systemic racism and mistreatment for over 400 years, we can definitely say, yes, there is a very valid reason why we may mistrust the healthcare community. History has broken the trust of the Black community. So when it comes to this COVID-19 vaccine, our best weapon is to be educated and informed. Now we're in a new day and time, and though the fight still continues, our best weapon is to be educated and informed. And so now I would like to take a little time to do just that as relates to the COVID-19 vaccine. So first, let's chat a bit about the vaccine development process. So with any vaccine, initially we start with preclinical testing. So the vaccine is given to animals, such as mice and monkeys, to see if it produces an immune response. If we're successful here, we move to phase 1 safety trials, where the vaccine is tested on a small number of people for safety and dosage. determination and to confirm that it stimulates the human immune system. If we are successful here, we move on to phase 2 or expanded trials, where the vaccine is given to hundreds of people, split into various groups by age. If we are successful here, we move on to phase 3 efficacy trials, where the testing is expanded to thousands of people. And so we know that with the Moderna and the Pfizer-BioNTech vaccines, their trials engaged about 40 to 50,000 people. Many of us have wondered, well, how many of those individuals were Black? So in those trials, we had about 10%, so 4,000 to 5,000 African Americans were in this trial. So we had a decent representation. After the phase 3 efficacy trials, then we move on for approval. And in this case, where we're dealing amidst a life-threatening pandemic, the approval process was sped up because we strongly felt that with over 500,000 deaths and millions of infections, that it was very important that we got what appeared to be and has continued to show us a very safe vaccine on the market so that we can stop the ravage of this disease. So Pfizer-BioNTech and Moderna sought what is known as an EUA, or Emergency Use Authorization. And this was granted by the FDA, and hence the vaccines, these 2 vaccines first hit the market and available for human use at the end of December of 2020. So I would like to take a moment here to speak a bit about Pfizer-BioNTech and Moderna mRNA vaccines. And so many of us wonder, what exactly is this mRNA vaccine? So here on the left is a 3D schematic of what the coronavirus itself looks like. And as you can see, extending from this virus, we see these red spikes, and they're known as the spike protein. And this is the portion of the virus that all of the vaccines thus far are being targeted towards, because it's this spike that allows the entrance of the virus into our human cells. So to trigger an immune response, many vaccines will put in a weakened or inactivated bacteria or virus into our body. So for example, the flu shot, the tetanus vaccine, which we all have had. But this is not the case with the COVID-19 messenger RNA vaccines. So no portion of the actual COVID-19 virus is being used. So these 2 vaccines actually contain what is known as a synthetic messenger RNA. So this is something that has been engineered, and this messenger RNA is basically a little piece of genetic material that has been programmed that once it is injected into our bodies, it produces a carbon copy of the spike protein that's on the actual virus. So as a result of producing this spike protein from the messenger RNA, our bodies respond to it as something foreign. And we make antibodies that fight this spike protein. So we get this process begun with the first shot, and then with the second shot, that's in 21 days with Pfizer or 28 days with Moderna. We get another shot, and this response is even more vigorously made. Therefore, our bodies have produced all of these antibodies against the spike protein, which is the concerning portion of the virus if we were to get infected. And therefore, it will gobble it up, if you will, the virus, if we were to come into contact with it. And that is why we will not get sick. So now I'd like to speak about the vaccines currently available. And so Pfizer-BioNTech is a 2-shot vaccine, as we're all aware. Moderna is also a 2-shot vaccine, as we are all aware. One that is on the horizon that will likely be in our physicians' refrigerators, hopefully next week sometimes, is Jansen, which is a subsidiary company of Johnson & Johnson. And what makes this vaccine different is a couple of things. So the Jansen vaccine, first off, is one shot, which I just think is huge. One shot. So you don't have to go back for that second shot as we do with Pfizer and Moderna. We do know that Pfizer and Moderna have about a 95% reported efficacy. Janssen's vaccine has about a 70 some odd percent efficacy against the COVID-19 disease. However, it also has an 85 to 100% efficacy against hospitalization and death, which is very impressive because those are really two of the most important endpoints. Also, the Janssen vaccine is not a messenger RNA vaccine. The Janssen vaccine is actually a DNA vaccine that's made very similar to the flu vaccine, the tetanus vaccine. So it uses that more traditional technology. The other thing is that the Janssen vaccine is not as fragile as our messenger RNA vaccines. And what I mean by that is the Janssen vaccine does not have to be frozen at these extremely low temperatures to actually maintain its integrity in a refrigerator for up to 3 months. So that's fantastic. As compared to the Pfizer and the Moderna vaccines, which are also excellent vaccines, they are more fragile though. So the Pfizer-BioNTech vaccine must be maintained in the frozen state at like -90 some odd degrees. And Moderna, similar, but not as cold of temperatures. And then once it's thawed, the Pfizer vaccine may last and maintain its integrity in the refrigerator for maybe a week. So we have to get those shots in the arms or they go in the trash. And that's definitely not something we want to see happen on such a precious commodity. The Moderna vaccine is similar. However, it may last in the refrigerator for about 30 days. And then if it's not in the arm, it goes in the trash. And again, with the Janssen vaccine, it can be maintained in the refrigerator for up to 3 months. There are other vaccines that are still going through phase 3 trials that may be coming around the pike in the United States over the next few months, and that's AstraZeneca, which is also a vaccine it's a DNA vaccine made very similarly to the Janssen vaccine. And it's a 2-shot as well. And one called Novavax, which is what we call a protein subunit vaccine. So it does not involve a portion of the virus, as does AstraZeneca and Janssen. It also does not use messenger RNA, as does Pfizer and Moderna. It is a protein subunit vaccine that, simply said, once injected into the body, it also elicits an immune response to what appears to be an identical type of spike protein. So in the end, all of these, regardless of what's at the core of the vaccine, they ultimately work the same way. By once they are injected into the body, they trigger an immune response from us, which is the development of these antibodies that fight off the spike protein so that if we were to come into contact with the actual virus, we're prepped, primed, and ready to go. Even though you may be vaccinated, it's still important to wear a mask. It's still important to wear a mask because if Representative Ford were vaccinated and he came into contact with an individual, one of his constituents who was not vaccinated, Representative Ford could still potentially transmit the virus to his constituent, even though Representative Ford would be okay because he's been vaccinated and his antibodies would fight it off. And so even though the vaccine is here and we are getting vaccinated, it's still important that we continue to wear our mask, not so much for the protection of ourselves, but for the protection of those that we may come around who have not yet been vaccinated. So even though I've been vaccinated, when I go home to travel to see my father and my elderly mother, even though I've been vaccinated, I must still protect them by wearing my mask. Next, I want to close by dispelling some myths. So 9 common myths as to the COVID-19 virus or vaccine. So number 1, we can't trust these COVID-19 vaccines because they were rushed. Well, the first vaccines, Pfizer and Moderna, they are messenger RNA vaccines. And yes, they do involve new technology. We've never had messenger RNA vaccines before. But it's not because, as far as it having been created so quickly, for shortcuts in the process. Even though it's the first time that messenger RNA has been used in a vaccine for the public, researchers have actually been working on this particular vaccine strategy as relates to messenger RNA for more than 30 years. So we're very familiar with messenger RNA. Number two, the vaccine will give me COVID-19. Well, as I stated earlier, so this is untrue. And as I stated earlier, with Pfizer and Moderna, there's no portion of the virus that's even being used. So it can't give you COVID-19. And with Jansen and AstraZeneca, yes, there is a portion of the COVID-19 virus that's being used, but it's an inactivated tiny piece of the virus. So technically, again, it's not giving you COVID-19. Number three, we don't know what's in these vaccines. Well, both Pfizer and Moderna, and I'm sure the others, have published their ingredient list for the vaccine. And you can actually find this on the website and see everything that is in the vaccine. Number four, these vaccines will alter my DNA. Well, that's not true. When the vaccine goes into our system, it's not entering the nucleus of our cells, which is where each of us houses our individual set of DNA instructions, if you will. It doesn't even go there, once it goes into our bodies. And so it does not integrate into our DNA. Actually, with the messenger RNA vaccines, once that messenger RNA has done its job and produced that practical replica of the spike protein, then it just disintegrates and dissolves and goes away. It doesn't integrate into anything. Number five, which I did address briefly earlier, I already had COVID-19, so I won't benefit from the vaccine. So that is a myth as well, because you will benefit from the vaccine, because we know that the antibodies that your body produced when you actually had the infection are only good for so long. And we believe that to be about 90 days. And so, yes, you do still need the vaccine. And number six, since COVID-19 survival rate is so high, I don't need a vaccine. Well, it is true. 80% of individuals who contract COVID-19 are going to be fine. And 20% of individuals will be hospitalized. And of course, a certain percentage of those individuals will be on the ventilator and will ultimately experience death. So yes, if you were to get COVID-19, 80% chance you'll do fine. Yes, the odds are in your favor. I know that I would not want to take that chance. I don't want to play that game of Russian roulette, that I might get the bullet. And we do know that we've seen individuals as young as toddlers. We heard a story not long ago about a healthy 17-year-old in one of our suburbs who was dead in a week. We just don't know. So just because we're young and healthy doesn't mean that this disease may not take us out. Number seven, once I get the vaccine, I won't have to wear a mask or worry about social distancing. And I touched on this a bit earlier as well. Yes, you will be protected, but your mom won't if she hasn't gotten it yet. And you could still transmit it to her, even though you've been protected, because you could still get the virus if you came into contact with it. But it's just that your antibodies that have been produced from your vaccine would fight it off. But still, if you have that virus on your person and you cough or sneeze or touch mom, you can still transmit it to her, and then she may have a very poor outcome. And so when it comes to when can we let the mask go, it would be when we reach a point of maybe about 70 to 80% of our population being vaccinated, which would mean that the chances of you encountering someone who has not been vaccinated and thus putting them at risk would be very low. And that's what we also tend to refer to as herd immunity. And so that's when, and only when, we can let the mask go. Now that we have vaccines, the pandemic will be over very soon. Well, yes, it's great that we have vaccines, but now we have to get vaccines into arms. And we do have two other experts on the call who are going to speak a bit more about that once I conclude. But we have to get the vaccines into the arms. And we also have to get the vaccines into the arms of those of us who have held traditionally a mistrust, because we have to do the right thing when it comes to saving our lives from a infection, from a disease that we know has disproportionately impacted our communities. The vaccine will cause infertility. We have no studies that have shown us that this vaccine will cause infertility. So in conclusion, masks continue to be our best weapon for preventing the transmission of COVID-19. Black America's mistrust of the healthcare system is understandable based on our history in this country. Education is our most potent weapon. Misinformation is our greatest enemy. And mass vaccination is necessary to save our lives. I'd like to say thank you for listening. And at this time, I would like to transition to our next speaker, Ms. Tamara Mahal, who is the COVID-19 vaccine lead for the city of Chicago. Thank you.
Hi, and good afternoon, everyone. I wanted to just provide some quick information about where we are in the city, but I think most importantly answer the big question of, well, where can I get vaccine, especially given yesterday's exciting announcement that we're going to have a very large mass vaccination site here in Chicago. So I'm going to go ahead and share my screen. And I just wanted to start by just giving a quick rundown as to where we are right now. So in the city of Chicago, we have administered over 560,000 vaccine doses. And across the city, in terms of how many Chicago residents have received their first dose, that's about 320,000. Those numbers are different because we do administer vaccine to people who work and live in Chicago. So we not only vaccinate Chicago residents, but also other residents. But rest assured, there are many Chicago residents also being vaccinated outside of the city of Chicago at their employer workplace. As of today, we're actually a little bit closer to 1 in 8 Chicagoans have received their first dose of vaccine. And we're very happy that 1 in 3 Chicagoans 65 plus have received their first dose of vaccine. I'll note that on the right-hand side, this is not skewed for population, so it's just based on the number of doses. And I'll just point out that where you see the lighter numbers, we are not seeing the number of vaccine uptake we'd like to, but of course, where you see the darker numbers, we are seeing some better uptake, and a lot of that is focused on equity. I'll notice that here in the city of Chicago, about 50% of the vaccines are going to people that are African American and Latinx, and that's one of the best rates in the country, but we need to be doing much better. Currently, we are in phase 1B as prescribed by the CDC. For us in the city of Chicago, what that means is that we're currently vaccinating Chicagoans that are age 65 and older, as well as frontline essential workers. What does that mean? Well, actually, if you go to chicago.gov/COVID vax, what you'll see is that there's actually a pretty detailed list of what it means to be a frontline essential worker. It's pretty specific to people that are working in education, grocery store, daycare, grocery store workers, manufacturing, food and agriculture, public transit, first responders, and a couple other folks that have been identified working as outreach workers or in congregate settings. And so we've been working our way through this phase since January 25th, but unfortunately, due to supply constraints, we still have a pretty long way to go. So the graphic that's on the screen shows that we have over 713,000 people in the city of Chicago that would qualify under phase 1B. As you can see there on the right, every week we get anywhere between right now about 50,000 doses a week. And while we're doing a good job of chipping away at the overall population that needs to be vaccinated, we're still only at about 30% of the city's residents that need to be vaccinated within 1B. You may have heard that the state of Illinois moved on to opening up to people with underlying conditions earlier this week, but unfortunately in the city of Chicago, Our demographics just don't support that quite yet. We want to make sure that people who are over 65 have access to the vaccine since they are the most vulnerable. This really comes down, though, to how do I get a vaccine? So I'm just going to start by saying that we know that it's been very frustrating to try to get a vaccine. It has been a little bit like the Hunger Games, and a lot of that is because of those supply constraints, but there still are a myriad of ways for people to try and get the vaccine if you're over 65 or you're a frontline healthcare worker or a frontline essential worker. The first is to check in with your healthcare provider, get on their list so that as they start to invite people in for vaccination, you're there. We have established a centralized appointment system called ZocDoc.com, where you can go and continuously check back. Multiple healthcare providers are posting their open appointments there to try and get an appointment. On the city's website, you can also find all of the different pharmacies that are currently offering vaccination to see if you can get an appointment there. But I think one of the things that we're most excited about is that President Biden and the White House determined that they would put a vaccination site here in the city of Chicago. So in partnership with the state of Illinois and Cook County, there will be a mass vaccination site opening on March 10th. It will have enough capacity to vaccinate up to 6,000 people per day and will be both a walkthrough and a drive-through. Now, the first 125,000 appointments or so, meaning the first really 3 weeks of appointments, are going to be dedicated to seniors 65 plus because they are so vulnerable and we want to make sure that they have primary access to those appointments. Please, 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 if you know seniors that are looking for vaccine appointments, start by talking to them, ask if they want a vaccine appointment, get ready because the city and the state and the county on Tuesday are going to be announcing when the appointment system will open. It will most likely open on Wednesday or Thursday so that people can go in and book vaccines. We'll be providing a phone number so that people who lack access to technology can call, and that will all be coming out at the same time in a press release saying this is when it's going to be, but we just want to make sure people understand now is the time to talk to your loved one and make sure they want that vaccine so you're ready to help them get that appointment the second that it's open. The city's also running a lot of special events in different communities you're going to start hearing about. And I did just want to point out, if you have a loved one that's living in a congregate or a senior living facility, we are working consistently to send out what we call strike teams, are also called mobile teams, to actually vaccinate that location. We've done about 270 plus locations thus far, and we're doing another 30 or so every week, including all of the CHA facilities in the city. So we're working through that. And then, of course, for our frontline essential employees, we're inviting people into our our vaccination sites, but also employers are posting vaccination as well. The city's also running a special program. It's part of our equitable distribution strategy. It's one of our initiatives called Protect Chicago Plus, where we identified the 15 communities that, based on a Chicago Department of Public Health vulnerability index, we're identified to have the highest burden from COVID-19. Those 15 communities you can see are mapped here. In those 15 communities, what that means is that while we're still prioritizing vaccine for healthcare providers in all burdened communities, we're allocating additional vaccine to ensure that the residents of those communities are able to be vaccinated, reducing the number of severe outcomes for them and ensuring that we can protect our most vulnerable. So if you live in communities like North Lawndale or Belmont Cragen or South Lawndale and Little Village or Austin, which will soon be starting up a new temporary clinic there on behalf of us, you will have access to the vaccine regardless of where you sit within the phase. If you are a resident of that community, you are eligible of vaccine, and we are pushing a lot of vaccine in that way. That does not mean that we are not addressing other communities. We're still prioritizing vaccine to other communities. We're setting up special events for seniors. We're sending out strike teams. We're just doing this to address the top 15, the first 15 most vulnerable as we move forward. And just as an example, North Lawndale currently has a vaccine clinic up and running through Protect Chicago Plus. If you are a resident of North Lawndale, you can call and try to get an appointment with Lawndale Christian. They do have appointments open for next week. And there's also clinics up and running in Belmont Cragen and all over the Southwest side. And I'd be happy to supply some of the flyers for that for sending out after this. But just as a note, those are coming to your communities. And like I said, we're going to be starting up in Austin here in a couple weeks, and more information will be coming then. And with that, I will turn it back. Thank you, guys.
Thank you so much. I appreciate that, Ms. Mahal. That was great information. Thanks for the shout out for Lawndale Christian over here in Lawndale as well. I want to take a moment to now turn it over to, Dr. Joshi from Cook County to talk a little bit about how Cook County fits into this equation and what you're doing. Dr. Joshi?
Absolutely. Thanks so much, Dr. Deere. Thanks, Dr. Bell-Baylark, for all those wonderful comments. And thanks to you, of course, Representative Ford, for hosting this. So I want to just be clear, the Cook County Department of Public Health is the health department for most of suburban Cook County. So my comments are kind of more specific to the suburbs, while we do work really closely with the city of Chicago and the state of Illinois on all of these vaccine operations. So at this point, 272,000 suburban Cook County residents have gotten at least one dose of the COVID-19 vaccine. That's around 12% of our population of 2.4 million. There's 89,000 suburban Cook County residents that have received 2 doses. So we are making progress. Looking at the numbers for phase 1B, which, as Dr. Bell-Baylark and Ms. Mahal mentioned, is frontline essential workers and individuals who are 65 years of age or older. That 65 and up population is the easiest for us to sort of look at and see how we're making progress. And we're through about 40% of that group having received at least one vaccination. And so again, I think this is sort of a testament to our public health systems and our healthcare providers moving through these populations rapidly. Now, obviously, we don't have enough vaccine for everyone, and I'm not trying to skim over that particular issue at all. So if you're interested in getting vaccinated and getting information about vaccination, I encourage all of you and your viewers to check out our website, which is cookcountypublichealth.org. Again, that's cookcountypublichealth.org. If you happen to live or work in suburban Cook County and want to get vaccinated, you could go to the website that we've set up for that purpose. There's a link on our website, but the direct link is vaccine.cookcountyil.gov. We also have a vaccine sign-up hotline that's open Monday through Friday, 7A to 7P, and that number is 833-308-1988. So you could put in your information, just some basics, and the website will tell you, what phase am I in? And based on that phase, you can get a sense of when you could be vaccinated. Based on the numbers that we're seeing now, if we continue to get adequate supplies of vaccine, and of course, depending on how many people decide to get vaccinated, we're projecting around a mid to late March transition from phase 1B to phase 1C. And again, as per Ms. Mahal's comments, phase 1C would open it up to additional essential workers, and folks who are between the ages of 16 to 64 and have a chronic medical condition. Just a word on some of the work that we're doing to vaccinate folks. We have the benefit of being connected quite closely to the public healthcare system in Cook County, which of course is Cook County Health. So not only are vaccines being administered through all their facilities throughout the suburbs and the city, but Cook County Health has done, I think, a phenomenal job of working with a number of stakeholders to set up vaccination sites throughout the suburbs. You may be familiar with one large site in the Southland in Tinley Park. We're also working to set up smaller size sites, community sites, in collaboration with local fire and EMS. We are doing mobile operations as well, focusing on congregate settings with vulnerable populations, including group homes. Intend to move forward with homeless shelters shortly, and workplaces with low-wage workers. And that's all in addition to community-based providers and partners such as pharmacies and private healthcare providers throughout suburban Cook County. As per the comments you heard earlier, we know there are a lot of folks out there that want to get vaccinated ASAP. And as a public health physician, I'm so happy to see that enthusiasm. The challenge that we have right now, of course, is just limited supply of vaccine. So we do ask for your patience given this limited supply.
Thank you so much, Dr. Joshi. Wonderful information. Very appreciative for all of our panelists. Really quickly, we know that several of our elected officials have to leave, and some of them had questions. I want to call on Senator Maddie Hunter. Senator Hunter, I still see you on the screen. If you're there, please speak now. Senator Hunter. Senator Hunter, you still there? Okay, maybe she'll come back. We will now go to President Carrie Steele.
Hello, everyone. How are you?
Wonderful.
So first, every presentation was great. I did learn and a lot of information. I have a couple of, well, one request and maybe one question. So Dr. Kimbra Bell Baylark, I loved your presentation, but specifically the slide about the 9 myths. Is there any way, because I get those questions all the time, is there any way we can either get a canned response statement for each of those myths, or even maybe a section of the video, Commissioner Deere or Representative Ford, that you can send us, maybe like a, a cutout of that section of her presentation that we can share socially and, just through our own platforms to our constituents. That's the request.
So just in response to that, was it President Steele or
yes. Yes.
President Steele? So in response to that, I'm more than happy to share. And so Representative Ford, Commissioner Deere, if you want to take a snippet of that and just share it out, I'm fine with that. Whatever you need me to do, let me know. But I'm happy to share that information. No problem.
Okay, awesome.
All right, and I was just informed that we are recording this. So we will make sure that we get that to you.
Okay, awesome. Thank you. And then,
all right, thanks, President Steele.
One more question, really quick. Ms. Mahal, if I were assisting a senior to book an appointment to get the vaccine, what information would I need? Like if they're not with me and I'm online because they're not like technical savvy.
That's a great question. So primarily what you need is some limited medical information from them. Phone number, email, full name, and date of birth. That's to get an appointment. It really depends on the system that you're trying to get into, but I presume you're talking about United Center. Yes. And after which they'll actually be prompted for additional registration information. I will note that it's best if you're on the phone with them while you're booking that appointment online, so that if any questions come up, you can immediately get them answered. You don't want to lose your appointment while waiting for additional information. The city, the county, and the state are working through communications materials right now so that we can distribute that and have it on our websites, exactly what you'll need to help assist a senior there. And then, as I mentioned, we'll also have a call center up and running for 2 things. 1, to help walk someone through the ZocDoc appointment site, or 2, to actually book an appointment for them right then and there, assuming that they're available.
Okay, thank you.
All right, thank you so much. I also want to acknowledge the fact that State Representative Collins joined us and Representative Barbara Hernandez. Thank you all for joining. Next person that we'll hear from is Representative Camille Lilly.
Thank you. Thank you, Commissioner Deere, and
you're welcome.
Again, Representative Ford, Chairman Ford, for the vision and bringing us all together. When we do things together, it's just always powerful. And of course, our panelists, you have brought forth wonderful information and access to healthcare. So that is really, really key. As we are working with our constituents, many of them may live in the suburbs, but work in the city, may live in the city, but work in the suburbs or the western suburbs. And when they're seeking vaccinations, if their one location is not available or booked or have a waiting line, how do we best respond to people who cannot get vaccination appointments?
Yeah, I mean, I think from just speaking for the Cook County Department of Public Health, we don't want that to be a barrier. At the end of the day, we want everyone to get vaccinated, regardless of whether they're a city resident or a suburban Cook County resident. And so as such, we don't want to ever be in a position of turning anyone away. We want everyone to be vaccinated. And I think having looked at our data, both of our departments are vaccinating folks who happen to live in the city or happen to live in the suburbs.
Thank you for that. All right. Was that all, Representative Lilly?
It is for now. I'm just excited that we're working.
Yeah, this is exciting.
Mm-hmm.
All right. Thank you so much. Well, now you're from Commissioner Kim DeBouclé.
Thank you, Commissioner Deere. Hope you can hear me.
We can.
So, Dr. Ballard, I actually have a few questions, and you can pick which one you want to answer. You mentioned that once you have once you've had COVID-19, that your immunity is good for 90 days. Has there been much research on if you get the vaccine, how long your immunity lasts for? Or in other words, I'm hearing we may have to get a booster shot once you get the vaccine.
So I'll respond to that one first, Commissioner. So first off, the first part of your question, we do believe that natural immunity that's gained from if you actually have the infection is about 90 days. We can't say exactly, but somewhere kind of in that range before you're again vulnerable. In regard to the length of time that you would be immune from the actual vaccination, we don't know the answer to that right now, because as you know, we've only had the trials just started like less than a year ago, right? Because it started since this pandemic has begun. So we are still following those individuals or that cohort that was studied, that 40 to 50,000 people. So 12 months, beyond when they got their first and second shot, we will have data that will let us know how strong the immunity remains. And so that's still a question that has yet to be answered.
Thank you. And then I know it's the question everybody wants to know. When can we take our mask off? And if we're vaccinated, can we hang around with other vaccinated people? Like if your mom is vaccinated and you're vaccinated, you still have to wear a mask.
And that's probably the answer is yes. That's probably the only scenario right now where you could take your mask off. So if everyone in the household has been vaccinated, then that bubble would not have to wear their mask. But in any other situation where you're in a group of individuals and everyone has not been vaccinated in at least two to 4 weeks after their, say, the last vaccination, whether it was a 1-shotter or a 2-shotter, but at least 2 to 4 weeks beyond that, then that would be the only situation where you could take the mask off. Otherwise, we still need to wear the mask because the other individuals would still be vulnerable. Not you, but the others would be vulnerable had they not been vaccinated.
Because the underlying question is, when do we get back to normal? And that's my last question.
That's the $1 million question, right? When will we get back to normal? And I would say the closest answer I could give you to that would be when we do achieve that around 80% immunity of our population in this country, or what we would then consider to be more like a herd immunity. And so right now, I don't know if Dr. Joshi or Ms. Mahal has those stats, but right now we may have maybe about 15% of the country vaccinated at this point, something like that. So only when we get to about 80% can we feel we're back to normal, no mask. And there will probably be, and I'm just guessing, because nobody knows, right? But just based on the rate we're going now, because our rollout has not been as robust as we had hoped for various reasons, but with the coming of other vaccines and replenished supply from our current vaccines, I would say probably around May, June, we shouldn't even have to be thinking about tiers. We should hopefully, listening to our president and the pharmaceutical companies, have just enough vaccine out there. By the time we hit kind of May, June, it's a matter of everyone going to get vaccinated. And so as far as just that, when can we really maybe be back to normal? I mean, I would guess early 2022, maybe late 2021, maybe. And that's if we go and get the shot.
Yeah.
Thank you.
I think that's a reasonable prediction. I think that makes a lot of sense to me. The one thing I would sort of add on to that's the wild card right now are the variants, right? And so how protective are the vaccines going to be against the variants? And what is the need going to be to get boosters, right? We're not quite sure about that yet. And so I don't mean to be the Debbie Downer in the room, but I just also want to temper expectations. So.
Good. Thank you, doctors. Thank you. We're now actually going to go to Representative Lakeisha Collins. Representative Collins, do you have any statement or question?
No, this was a great presentation. I think about one of the best ones I've been on so far. My question, I think, was already answered early on when the doctor was speaking about the age groups, the expansion of the different age groups. Because I hear that a lot from some of my parents about going back to school and, their kids becoming getting their vaccination. And so I don't know. I mean, if you can give me like an idea on that, like how that'll look moving into that phase, like how soon can we see that with this new vaccination center with the United Center? And then there is one that's a pretty big operation with UIC at Credit Arena. So like, how would that look as far as like the age group?
I want to make sure I understand the question. Are you saying, asking
the next phase? Because I know the doctor was talking about the different phases. Like if everything go right, we're moving to another phase where we'll look at the different age groups. So like how young will we be able to vaccinate children? Because I know in areas it's 16 or 64. So like, will we be able to go, 7?
Lower.
Yeah, something like that.
Anyone want to answer that?
I can take a stab at it, and then and I'm happy to let Dr. Joshi or Ms. Mahal as well. So in regard to trials in children, we do know that with our vaccine so far, it has been maybe as low as 16 or 17 and above as far as ages. But they are actually now conducting trials with these same vaccines in children and younger ages. So we're just kind of getting that going. So as far as us actually knowing when we're going to have that data where we can say the 12-year-old can get vaccinated, we don't have an answer right now. But what we do know is that trials now are being conducted with pregnant women as well as individuals under the age of 16. And so we'll just have to wait and see when that data is presented.
Okay, thank you.
Thank you, Doctor. Anyone else want to try that one out? Or does the doctor's answer suffice? Yeah. All right. Next, we'll have State Representative Debbie Myers-Markey.
Well, thank you, Commissioner Deere, and thank you again to Dr. Kimbra Bell-Balark and all of the presenters, Representative Ford. This has been fabulous, and I'm certainly very excited to be part of this most informative town hall. My question is, Dr. Bell, you mentioned the Jansen vaccine, and I know that that's the newest vaccine on the market. Is that available in Illinois now? And if not, If not, then when? When do you foresee it being available? And it may be less desirable because it's not as effective as the others, but could you just expand on that just a little bit?
I'd be happy to, and I think that's a wonderful question. So, if it rolls out as into the populations as fast as Pfizer and Moderna did, because literally when they got their approval for their EUA or emergency use authorization, I believe it was a Friday, and we had it at Northwestern Loretto Hospital and other places on Monday, that following Monday. So, it rolls out that same type of speed as soon as I think. And correct me if I'm wrong, Dr. Joshi, but I believe there's one final vote that needs to be taken. But and when that's done, I think it may happen on Monday. It could be in doctors' offices as soon as midweek. I mean, if it goes out as fast as Pfizer and Moderna did. So next week, sometimes potentially, we could have the Jansen vaccine in Illinois, in Chicago. So pretty fast. And then in regard to effectiveness, I do think that the Janssen vaccine is an excellent vaccine. And the last thing that we want to put out there is to people is that, oh, that one isn't so good. I want to try to get this one, because in general, you're not going to really be able to pick and choose, which one you get in general. You probably won't be. But I do think Janssen is a good vaccine. Now, we've all heard the 95% kind of overall with the Pfizer and the BioNTech. So with the Janssen vaccine, yes, the efficacy is somewhat lower. It's 70 some odd % on the against the virus. However, when we look at two of our biggest endpoints, which is being hospitalized from this and particularly death, is 85 to 100%. Actually, the studies say 100% against death. You won't die if you get this vaccine. So we're saying 100% against death, about 85% plus against hospitalization. And I see Dr. Joshi appears to agree with me. So it's still an excellent vaccine. And so I would not try to play the pitting one against the other game. I really think the key is get vaccinated.
Thank you.
Thank you so much. And I want to circle back around to Representative Barbara Hernandez. Do you have a question or statement you'd like to make?
Thank you so much for having this. That's honestly the only statement I have. It's really informative. It's great to know what else is going on in other parts of the state. Currently, well, I live in the suburbs, so for me, it's really informative to have this conversation. So once again, thank you so much.
Thank you. We appreciate you very much. Let me jump before we hear from Representative Ford to some questions that are actually in the chat. This is from my good friend, David Sanders from Malcolm X. Dr. Balark, there have been several indications from national health officials that we could reach herd immunity in the summer, assuming vaccinations continue to rise. 200 million or more Americans. Do you believe that herd immunity is possible this summer? And if so, I think we might have covered this. And if so, would health protocols change? What would that change look like? We may have covered that.
We covered a portion of it, but as far as the timeline, he's asking, do we think we'll reach herd immunity by this summer? I don't think so. Now, granted, I can't predict the future, but I don't think so. I only think we won't even get to the point where hopefully it'll be almost kind of like a come one, come all as far as availability until probably maybe May or June. And so then we're kind of hitting the summer anyway. So no, I doubt that herd immunity will be reached by this summer. Hopefully we'll have reached it by maybe late this year, very beginning of 2022. And again, the mask can come off.
Let me go further on that, Dr. Dennis Deere. So we talk about herd immunity, but it's national. Are states trying to reach a herd immunity, or is this only on a national level?
I think it's more so on a national level because people travel, right? And so, so you have, we all travel. And so it's a national thing, not a state thing. Because we travel, we may feel we're in herd immunity maybe in one state, but then you have people traveling into our state, people traveling out of our state. So it's really more of a national goal we're looking at.
All right. Thank you so much. I have another question, and I need to get to the chat to get it. So Senator Maddie Hunter, I think she may have not come back yet, but she did have a question. Her question is regarding the effectiveness of using HCQ in substitution of the vaccine.
Right.
Is that effective?
Correct.
Oh, there you go. There she is.
Hello, how are you? Good to see you. I don't have an answer to that question. I'm not sure if Dr. Joshi may have something to add, but I can't speak to that, so I don't want to give any misinformation.
Yeah, I think by HCQ, do you mean hydroxychloroquine?
Yes. Yes.
I didn't know what it was. I was going to ask.
Yeah.
Oh, okay. Okay.
Yeah, and so I mean, I think this has been looked at in terms of treatment for COVID-19, and my understanding from the data I've seen is that it's not effective. This is something that was promoted by the previous federal administration, and I think has since kind of been debunked. It's important to remember that there's treatments, right? So if you get sick, you could give somebody, for example, the steroid like dexamethasone, and that's been shown if you're sick to help you get better faster and to prevent you from getting sicker. And then there's prevention, right? And so we take vaccines before we get sick to prevent ourselves from getting sick. And so the vaccines that we know are effective at this point are the ones that have been discussed previously. So just wanted to separate the two things.
Yes, I like to say ditto to what Dr. Joshi just said. I agree with him 100%. When you said HCQ, Commissioner Deere, I did not realize that was hydroxychloroquine. So I agree. That's a that was purported as a treatment, but not so much supported now. And as Dr. Joshi said, we look at things like dexamethasone, convalescent plasma, things of that nature that are actually have been shown to maybe help lessen the severity of the disease or the length of course of the disease. Hydroxychloroquine has not panned out to be what we thought it would be as relates to treatment. And then as he also said, we have treatment in one category, but now we're talking about prevention, which is the vaccine.
All right, thank you so much. I'm going to rapid fire a few last questions out. If those are yours, please answer. A question that we hear often is, will I be charged for getting a vaccine? What's the answer to that?
No, no. And in fact, that's across the state. It's actually across the nation. So you are actually, when a provider signs on to get vaccine and they become enrolled as a provider, they sign an agreement with CDC that says that they will not charge for vaccine. They cannot charge you to receive the vaccine. They should not be charging you for the administration of the vaccine. They can bill for certain fees to your insurance. However, they're not allowed to turn you away if you don't have insurance either. So it's very, very important. A couple things on that. First, don't let that be a barrier. This is not like the flu vaccine where if you go to Jewel but you don't have the insurance, you still pay $10. No, you can't get nothing can be charged. If you hear of or someone's trying to charge you money, for a vaccine, you can go to the City of Chicago's vaccine website, and there's some information up there about how to report what we call fraud, because that's what that is, so that we can find out, address that with the healthcare provider, stop them from getting vaccine, and report them to the Illinois Department of Professional Regulations. And I am sure that Cook County also has some information on that, so that if you see that, please let us know. We do not want that to be a deterrent, and it's not legal.
Thank you. I know that's a question that many ask. As a follow-up question to that, does an individual need an ID in order to get a vaccine?
You do not need identification to get a vaccine. And I want to be very clear about this, because what that question drives at the heart of is, do I need to be a citizen? And you do not. The vaccine is for everyone. COVID does not discriminate based on your citizenship status. So you do not. Now, you will see some providers are asking for certain levels of documentation for residency status. Most often at this point, they're just asking for a piece of mail with an address on it. And anyone that would require an ID for age verification or anything like that, if you don't have one, they will not turn you away from getting the vaccine. But please know that that is not a requirement.
Well, thank you for saying that, because I've actually seen some flyers that say you got to have an ID in order to get it. So that is a myth. You should not have to have an ID. Thank you for answering that. How can I find where and when I can be vaccinated?
Yeah, so I think I sort of started, I jumped the gun on this one, I think, because as I mentioned, we've got a website, cookcountypublichealth.org, and that'll give you general information about our health department. There's a link to the sign up website, which is vaccine.cookcountyil.gov. And I saw that Ms. Melva posted the phone number that folks can call in the chat box. So any of those resources would be great.
All right, and if there are additional numbers that you may have, Ms. Mahal from the city, please put that in the chat so that people know the website and the number to call. Thank you, Dr. Josie. As a follow-up, and this is a good follow-up too, should I wait to see if there are more side effects from the vaccine before I get it? I've heard that a million times.
Yeah.
Go ahead. No, go ahead, Dr. Joshi. I'll follow up. Go ahead.
I was just going to cite you, Dr. Bell-Ballark, and say, as you heard Dr. The good doctor say, the development process was quick, but the research was conducted in the same way that all vaccines are researched and no corners were cut. Both the vaccines that are available right now have really, really good safety profiles, and we're continuing to monitor for any additional safety problems that may come up. So my recommendation at this point is a really strong don't wait. You have a lot more risk from getting COVID and getting sick from COVID than you do from the vaccine. The risk of any kind of reaction or problem from the vaccine is very low.
I agree.
Thank you for that. Did you want to follow up, Dr. Baylor?
No, I just said I agree.
That was a great answer. But I like this next question too. I've heard this from a lot of my constituents. With the Pfizer and the Mrna vaccines, is COVID-19 virus being injected inside of me? And I think you covered some of this, Dr. Baylor.
Yes, that was in my presentation. And the answer to that with the is no with the mRNA vaccines, because as I said earlier, it's a piece of genetic material that has been pre-programmed that once it's injected, it actually will produce a carbon copy of what that spike protein looks like. And that's how our antibodies are formed against that to protect us in the future. And so no COVID-19 virus is being injected with the mRNA vaccines. With the DNA vaccines, like the Jansen vaccine, is using technology that we've used for years and years and years and years, like say with the tetanus vaccine, the flu vaccine. There is a very small portion of the COVID-19 virus that's a part of that vaccine, but it's a small portion. It's an inactivated portion that's being used. So technically, again, you're not really being injected with the virus itself. It's just a very small inactivated portion that still has the potential that once injected to cause antibodies to be produced against the virus.
So with that being said, Dr. Baylor, have you been vaccinated?
Yes, I have. I had the, I would be 1A because I'm a healthcare worker, and
okay.
I had the first vaccine that came out, the only one that was available to me, which is totally fine, and that was the Pfizer-BioNTech vaccine. We got it at Northwestern the same day the Loretto Hospital got theirs.
Side effects?
So the first shot that I got, I had severe pain at the injection site, where I did have to take a little over-the-counter pain medication, but that was pretty much gone within a day or two.
Okay.
With the second vaccine, which is the one where we tell individuals that you may expect to potentially have some side effects. The second one, my side effect profile was pretty mild. I was very tired, very fatigued for a couple of days. I had mild headache and some mild nausea. I've spoken with other individuals that had maybe low-grade fever, muscle aches and pains, felt like they had a little case of the flu or something.
Yeah.
that happens, I mean, it's not necessarily an uncommon thing, but when they get that second vaccine, your immune system has already been revved up a little bit with that first one. So when it's injected into you again, you really get an even more vigorous response. It's really just your body just responding, and it's a good way of saying, hey, this is really working. Even though if you don't get those symptoms, it does not mean that it's not working. But that is what it's a result of, and very short-lived, maybe 2 days, 3 times.
Yeah.
Nothing severe that I've heard, and mine were pretty mild.
Yeah, I had it too, and it wasn't super crazy, but I did have fatigue, chills, hot flashes, the whole 9. So it was interesting, but I'm glad I got it. A couple of other questions, and one in particular, we're hoping someone can ask. When these tests were done by Pfizer and Moderna, et cetera, was any Black people included? Because some people, some of my constituents have come to me and said they probably had no Black people in the test, and they tried trying to use us as a Tuskegee experiment. They tested all the white people and then they include the Black people. So, they're just giving us something they don't know going to work on us. What do you all have to say about that?
That's a really good question. I did touch on that a bit in my talk, and I'm happy to touch on that again because it's a great question. So thanks for bringing that forward, Commissioner Deere. But yes, I don't have the statistics for the Jansen vaccine, though I can look that up. But I do know that for Moderna and Pfizer, there were about 40 to 50,000 individuals in these trials overall, and there were about 10% of that, which is a respectable representation, but about 10% were African American. So we're talking about 4,000 to 5,000 Black people were tested as well, and then we did not see any untoward response within the Black cohort as we did in our Latinx cohort or Caucasian cohort. So it seemed to have worked as effectively as well. No difference based on ethnicity.
That's good to know. I just saw another question pop up. Have there been any harsh side effects for individuals that might have pre-existing conditions? Diabetes, multiple sclerosis? You heard anything?
That's a good question. In general, I would say the answer to that is no. And I would also say that those individuals with the comorbid conditions like diabetes, heart disease, are individuals that we even more so want to get the vaccine, because we do know that by having these comorbidities, it puts you at an increased risk for a poor outcome if you were to contract COVID-19. So actually, probably quite to the contrary, as far as making sure that if you have certain of these comorbidities from chronic kidney disease, which is very prevalent in the African American population, chronic lung disease, such as COPD, bronchitis, emphysema, severe asthma, these kinds of things, heart disease, are situations where we really want you to get vaccinated, because you could have a very bad outcome if you were to contract the disease.
Thank you so much, Dr. Baylard, Dr. Joshi, and Ms. Mahal. It has been a delight. You have answered several questions. I'm now going to turn it over to the esteemed Representative La Shawn Ford, who will continue on with our agenda. And I think he's probably going to ask Representative Lilly a couple questions. Dr. Ford. I made him a doctor now.
Yeah, and so that we just stick with Dr. Deere. There was one more question before we turn it over to Leader Lilly about some information about the state. And Ms. Anderson did ask a question that just came through. And the question is, children, youth, and families experiencing homelessness are put at increased risk of transmission of COVID-19, as they are often living in double up situations, temporary living with others with little to no space to quarantine. Is there any prioritization for population to receive vaccinations?
I can start with the city, and I'll just note that people experiencing homelessness have been prioritized for vaccination by the city of Chicago, because they do experience significantly increased rates of transmission for COVID-19. We have focused on vaccinating first shelters, but have actually now started to move on to encampments as well, to be sure that we can address that population as quickly as possible.
Doctor, do you have any other?
Same. Yeah. So we're doing mobile operations. I don't think we've started at shelters yet, as we're focusing on other settings, but they're certainly on our list of places to go.
And next, I think we'll go to Leader Lily. I mean, healthcare is what she lives and dies for. She always say, if you don't have your health, you don't have anything. And she is also now the chair of Human Service Appropriations. So we're very happy to have her in that role. And she has a statement for the state.
Mm-hmm. Thank you again for joining us. And it takes all of us, all levels of government, to deal with this issue, this national issue. And we want to thank you all for joining us at what we call a local discussion and educational panel. We here at the state of Illinois, we work very closely with the governor, and we work closely with the Illinois Department of Public Health. And I want to share their contact information because we have questions that come to us constantly. So real quickly, we have a pamphlet that if I can figure out how to drop it into the chat, that talks about the Illinois Department of Public Health and their questions that they are looking to answer on our website. So if you have questions about COVID-19, you can call the number 1-800-889-3931. Again, that's 1-800-889-3931. And we have an email as well, and that's dph.sick@illinois.gov. Any questions you may have, any concerns you may have, please email us and we'll get right back to you. And of course, we have our website where this information is also located, and that's www.dph.illinois.gov. Again, www.dph.illinois.gov. And as you know, we have been working very diligently as a state to make sure that we did testing, we now are doing vaccinations, and then we have to continue to make sure everyone have access to care. Because COVID has demonstrated that when you don't have access to healthcare, you have increased number of underlying health conditions, which will cause you not to be prepared for a pandemic of this nature. And we in Illinois, in our great country, should make sure that everyone has the right to healthcare, because when you don't, you have alarming numbers that are existing in our country. Over 500,000 persons have not survived the contraction of COVID-19. That's far more than other countries. And this is a global pandemic. So I want to make sure that Illinois is a part of the team. Illinois is a part of supporting the healthcare practices within all of our communities. And I just once again want to thank each of you for coming to a grassroots conversation that lets people know that we are here for them, and we're here to provide education and information and access. So thank you all. And thank you, Representative Ford, for allowing me to share.
Thank you. Now, you know, one of the things that I often know is that there's always a point where you wish you said it. Here's your chance right now to raise your hand if you wish you had said it. If you raise your hand, we'll call on you before we have our closing remarks. So nobody wished they had said it. There's your chance, going once, going twice, and the wish I had said it is over. It's closed. So let me close out by saying, Dr. Bell-Baylark, you've done a fantastic job. I want to thank you so very much I know that this took time away from your lovely family, because you put so much effort in making sure that this was done first class. And Dr. Dennis Deer, you're welcome. And Dr. Dennis Deer, you are a good partner and a friend in this, and I really enjoy working with you. And I want to thank all of the other panelists for the work that you've done to make today's town hall a success. I would think it's a success because you guys provided such great information. So thank you for sharing that information and being committed to the communities that you serve. And I hope you all stay safe. And we look forward to the end of the pandemic and, of course, the new way of life moving forward. Thank you so very much. And this concludes our town hall. Bye-bye.